There are 19,615 confirmed cases of coronavirus in total since the beginning of the pandemic in Victoria. That's an increase of 55 since yesterday's report. There have, I'm sad to say, been 683 Victorians who have lost their life due to this global pandemic. That's an increase of 8 since yesterday's report. 2 males in their 60s, 2 males in their 80s, 1 female and 3 males in their 90s. We, of course, send our condolences, our sympathies and best wishes to each of those 8 families. 6 of those 8 deaths are linked to aged care outbreaks. There are 238 Victorians in hospital. 22 of those are receiving intensive care and 13 of those 22 are on a ventilator. A total of 2,412,092 test results have been received, which is an increase of 8,704 since yesterday. Just if I can pause on that for one moment, that is less tests than we would like, but we will see, I think, in coming weeks and months, with so little flu, so little cold symptoms, we will see less symptomatic people in the community in general. How that should be heard, how that should be, what that should basically motivate is anybody with even the mildest symptoms, because cold and flu is so low, if you have even mild symptoms, the chances of you having this coronavirus are that much higher. That's why it's so important that every single Victorian who has even the mildest symptoms, as soon as those symptoms begin, please come forward, please visit one of the more than 190 test sites across the state. Please get tested and isolated home till you get your result. Those results are coming through, the vast majority now within 24 hours, because of course volumes are down and the number of positives, every one of them is critically important. It's that sort of intelligence, that data, that allows us to have the best public health response and the greatest certainty about how much virus is out there in the Victorian community. Can I give a shout out to the Apollo Bay community, where many people came forward for testing following the sewerage surveillance, the fact that virus was found through that process. We're very grateful to each of them who've come forward and got tested. Again, there's everything across the board in terms of following rules, looking out for each other. It's all very important, but arguably the most important contribution that you can make is if you've got symptoms, even the mildest symptoms, to come forward and get tested. It's a simple thing, but a really powerful thing that you at a personal level can do to get us all out of these rules and to a COVID normal sooner than would otherwise be the case. There are 4,344 cases of unknown source. That's a decrease of 25 since yesterday's report. There are 260 healthcare workers who are active cases, and we again wish them well and thank them for the amazing job they're doing in health and aged care services right across the board. They really are doing the best of work, and we send our best wishes to them, those who have contracted the virus. There are 1,696 active cases in Victoria, so that number continues to steadily fall. In terms of the regional metro breakdown, I'm very pleased to be able to say that there are now just 82 active cases in regional local government areas under the Stage 3 rules. Those communities that have been of greatest concern to us, if I can just give you a quick sense of those, no new cases in regional Victoria across the board. Colac has 25 active cases, of course, though, because of that one outbreak, and that speaks directly to just how infectious and just how quickly this virus can get away from you. One person goes back to their local community, and within the space of a week, one person has meant that some 25 people in that community have tested positive. Greater Geelong more broadly, 16 active cases. Greater Bendigo, 2 active cases. Ballarat has just 1 active case. So those numbers are falling steadily, and I want to thank everyone across regional Victoria, from big regional cities to the smallest of country towns. You're all doing an amazing job, but it is important to keep coming forward and getting tested. It is important that we stay the course. We are very confident that we will reach our target in terms of the 14-day average, and as soon as we can have those very substantial changes, not one step, but in fact 2 steps along that roadmap to COVID normal, applying across regional Victoria, that's exactly what we will do.